Dear audience, suppose this is tissue, this is artery supplying the oxygenated blood in the tissue, and this is the venule or vein that carries the deoxygenated blood from the tissue. If there is sudden occlusion of the artery, no blood will enter in the tissue and tissue undergo ischemia. And if the ischemia leads to necrosis here, by definition, this ischemic necrosis is called infarct. Again, if there is impaired venous drainage, impairment of venous return, what will happen? As there is impairment of venous return, in the tissue there will be accumulation of deoxygenated blood. If there is impaired venous return, what will happen again? There will be accumulation of deoxygenated blood in the tissue. If there is more and more accumulation of deoxygenated blood in the tissue, there will be no entry of oxygenated blood from the artery in the tissue, and at this time the tissue will be hypoxic. There will be no oxygen, and so the tissue will undergo again necrosis, and such type of necrosis due to impairment of venous return by definition is called infarct. Again, localized area of ischemic necrosis either due to sudden arterial occlusion or due to impairment of venous return is called infarct, and the phenomenon is called infarction. The phenomenon is called infarction. Dear audience, now come to suppose this is artery supplying this tissue, this is the capillaries. If sudden arterial occlusion here, no blood is coming in the tissue, there will be infarct. So, sudden arterial occlusion leads to infarct or infarction. Infarct. If sudden arterial occlusion, there will be infarct. If dilatation of the arteriole, if there is dilation of arteriole, what will happen? Dilatation of arterial artery, there will be increased blood flow in the tissue, and this increased blood flow tissue is called hyperemia. That will get in fever. And if there is narrowing of the blood vessel, blood vessel become narrow. If narrowing of blood vessel, what will happen? Following narrowing of blood vessel or arteriole, there will be diminished blood from the tissue. Diminished blood flow in tissue. Dear audience, narrowing of arteriole leads to diminished blood flow in the tissue, and you know one of the cause of atrophy is diminished flow of blood in tissue. So, if diminished flow of blood in tissue following narrowing of arteriole, what will happen? There will be atrophy of the tissue. Again, arterial occlusion leads to infarct, dilatation of arteriole leads to hyperemia, and narrowing of arteriole leads to atrophy. Now come to what are the types of infarct. Now the types of infarct based on presence or absence of infection. First, based on presence or absence of infection. Dear audience, we know inflammation caused by microorganism is called infection. Based on presence or absence of infection, two types. One is septic infarct. Infarct, where there is presence of infection, it is called septic infarct. Another is blunt infarct. Means the infarct where there is no infection. Now come to based on color. Based on color, infarct may be pale or anemic. Based on color, first one is pale infarct or anemic infarct. Dear audience, you know anemia means reduction of hemoglobin per unit volume of blood below the normal level as per age and sex. And in anemia, there is pale coloration of skin and sclera. And if the infarct, localized area of ischemic necrosis, is in pale, this is called pale infarct, or it is called anemic infarct. It is caused due to sudden arterial occlusion. If sudden arterial occlusion is associated with infarct, that infarct will be pale or anemic. Because if sudden arterial occlusion, no oxygenated blood or arterial blood enters in the tissue, and all the deoxygenated blood will come out from the tissue via the venule. So the infarct become pale or anemic. Another is red infarct. It is also called hemorrhagic infarct. Hemorrhagic infarct. Dear audience, on the basis of color, pale infarct or anemic infarct, another is red infarct or hemorrhagic infarct. It occurs when there is impairment of venous return. If impairment of venous return from the tissue, there will be infarct, and this infarct will be red or hemorrhagic. Dear audience, if this is the arterial, again, if this is the tissue, and if this is the venule, if artery is okay, and artery is patent, and if there is impairment of venous return is impaired, what will happen? There will be accumulation of deoxygenated blood, and at one time there will be no entry of oxygenated blood via the artery in the tissue. At that moment, the tissue undergo necrosis, but there is presence of oxygen, presence of deoxygenated blood here. So due to presence of deoxygenated blood here, the infarct become red, or it is called hemorrhagic infarct. Dear audience, now come to red infarct. Red infarct, again, infarct is localized area of ischemic necrosis. It is localized area of ischemic necrosis. If the localized area of ischemic necrosis is red, this is called red infarct. So color is red. The cause of red infarct is impaired venous return. Cause is impaired venous return. And the red infarct is usually associated with edema. Usually edema present. Dear audience, we know edema. What is edema? Excess accumulation of fluid in tissue or in serous cavity is known as edema. Common sites of red infarct: intestine, when there is intestinal obstruction like strangulated hernia. Intestine, if intestine undergo infarction, the red infarct occurs there. When strangulated hernia, you know, if the hernia is strangulated, what will happen? There will be venous drainage impairment. Due to venous drainage impairment, the intestinal part undergo ischemic necrosis, and this necrosed part become red or hemorrhagic. Intestinal obstruction. Another site, lung. Dear audience, if there is infection in the lung, the infarct become red or hemorrhagic, you know. Testis. Dear audience, you know, when testes undergo torsion, if torsion of testes, what will happen? If there is torsion of testes, what will happen? The testicular vein undergo twisting. So there will be impairment of venous return and testes undergo red infarct. Ovary. Dear audience, if this is ovary, at the fimbriated end of fallopian tube, if the ovary undergo twisting, if twisting at the fimbriated end of fallopian tube, there will be impairment of venous return and the ovary undergo red infarct. When there is twisting of ovary. Twisting of ovary. So twisting of ovary is associated with red infarct in ovary. Another site is vulva. So these are the common sites of red infarct. Now come to pale infarct. Dear audience, the pale infarct is anemic or pale. Pale or anemic. Cause is sudden arterial occlusion. Dear audience, again, if this is the arteriole and if this is the tissue, and if this is the venule. If sudden arterial occlusion here, no arterial blood enters in the tissue and the tissue undergoes ischemic necrosis, and as there is no entry of blood, the necrosed part become pale, so it is called pale or anemic infarct. Usually edema is absent. We get usually edema in red infarct, but in pale infarct edema is usually absent. Common sites. Common sites: heart, kidney, liver, adrenals. These are the common sites. Again, heart, kidney, liver, adrenals. Dear audience, you know there are many types of ischemic heart diseases. One of the ischemic heart disease called myocardial infarction. So myocardial infarct is nothing but pale infarct, and it is due to sudden coronary artery occlusion, you know. Dear audience, now come to what are the factors that influences infarction, that influences infarct. I have told you definition of infarct, type of infarct, different sites of pale and red infarct, what is the cause of pale, what is the cause of red. I have told you. Now come to what are the factors that influences infarction. Dear audience, factor influencing infarction means some factors may enhance infarction, some factor may delay infarction. What are those? Oxygen content of blood. First one is oxygen content of blood, then rate of development of arterial occlusion, then nature of vascular supply, then tissue vulnerability, to hypoxia, and last one is cardiorespiratory status of individual. Dear audience, these are the factors that influences infarction: oxygen content of blood, rate of development of arterial occlusion, nature of vascular supply, tissue vulnerability to hypoxia, and cardiorespiratory status of individual. Now come to oxygen content of blood. If oxygen content of blood is diminished or decreased, there will be enhancement of infarction. Diminished oxygen content of blood, enhancement of infarction. Now come to what are the different causes where there will be diminished oxygen content of blood. Causes of diminished oxygen in blood. One is hypoxic condition. Hypoxic condition of individual. Another is anemia. Dear audience, you know anemia is nothing but reduction of hemoglobin per unit volume of blood below the normal level as per age and sex. So in anemic patient there is reduction of hemoglobin. So in anemia there is decreased hemoglobin. As hemoglobin is decreased, so oxygen carrying capacity in the blood is decreased. You know oxygen is carried by hemoglobin in the tissue. As there is reduction of hemoglobin, so there will be oxygen content in blood is diminished. Oxygen in blood is diminished. As oxygen in blood is diminished, so cell and tissue gets minimum oxygen, and minimum oxygen is associated with enhancement of infarction. So if anybody suffers from anemia and if there is chance of myocardial infarction, the enhancement of myocardial infarction occurs in patients suffering from anemia. What are other causes of diminished oxygen content? Carbon monoxide poisoning. Carbon monoxide poisoning. What are other causes? Lung diseases like COPD. You know, chronic obstructive pulmonary diseases. These are the lung diseases, chronic obstructive pulmonary diseases. It includes bronchial asthma, emphysema, bronchitis, bronchiectasis. All are associated with hypoxia. All are associated with hypoxic conditions. Heart disease like cyanotic group of heart disease, cyanotic group of congenital heart disease are associated with hypoxia. So heart disease, lung disease, carbon monoxide poisoning, anemia, all are associated with diminished oxygen in blood, and it enhances infarction. Now come to rate of development of arterial occlusion. Dear audience, this is artery, this is a tissue supplying blood. If the arterial occlusion occurs suddenly, there will be enhancement of infarction. If there is slowing of occlusion, or if there is diminished rate of development of arterial occlusion, infarction will be delayed. So faster the rate of development of occlusion, enhancement of infarction, and if there is no faster of rate of development of arterial occlusion, infarction will be delayed. Now come to nature of vascular supply. Dear audience, you know in our body there are some tissues where there is dual blood supply. So the tissue with dual blood supply is less sensitive to infarction. Tissue with dual blood supply is less sensitive to infarction. Now come to examples of tissue with dual blood supply. One is lung. You know in lung there is pulmonary circulation and there is bronchial circulation. So there is dual blood supply in the lung. So in the lung there is less chance of infarction, that is lung is less sensitive to infarction because of dual blood supply. One is pulmonary circulation, another is bronchial circulation. Liver is also less sensitive to infarction because it has got two types of supply. One is hepatic circulation, another is portal circulation. Another example is palm and forearm. Palm and forearm. Dear audience, you know our palm and forearm, there is ulnar artery and there is radial artery. So there is dual blood supply. So palm and forearm is less sensitive to infarction. Now come to tissue vulnerability to hypoxia. Dear audience, you know in our body there are many types of tissue. Some tissue is more sensitive to hypoxia and prone to develop infarction immediately, and we have got some tissues these are less sensitive to hypoxia, and if there is development of infection it will be delayed. This is called tissue vulnerability to hypoxia. Now come to examples. Brain. Our brain is more sensitive to hypoxia. So brain cannot tolerate ischemia, cannot tolerate hypoxia for more than 5 minutes. It cannot tolerate any hypoxic condition more than 5 minutes. Kidney and heart. Our kidney and heart, it can tolerate hypoxia up to 30 minutes. Skeletal muscle. Our skeletal muscle can tolerate hypoxia or ischemia up to 1.5 to 2 hours. Up to 1.5 hours to 2 hours. So our brain is very sensitive to hypoxia, kidney is less sensitive, and skeletal muscle is least sensitive to hypoxia. This is tissue vulnerability to hypoxia. Dear audience, as our skeletal muscle is less sensitive to hypoxia, so if anybody comes to with shock in the world, and if you are attending doctor, what is your first work? What is your first job? What you should raise the foot end of the patient, because the foot or the lower part of the body, that is skeletal muscle, it needs no blood immediately, but blood should needed in the brain and in the kidney and heart. So we raise the foot end of the patient when the patient comes to the world with shock. And the last one is cardiorespiratory status of individual. Cardiorespiratory status of individual. Dear audience, if anybody suffers from cardiac disease, and following cardiac disease, if there is myocardial infarction, there will be enhancement of the infarction. So, pre-existing disease in the heart is associated with enhancement of infarction, and pre-existing disease in the lung is associated with enhancement of infarction. This is called cardiorespiratory status of individual. Dear audience, this is up to infarct and infarction. I have told you what is infarct: localized area of ischemic necrosis, either due to sudden arterial occlusion or impairment of venous return, is called infarct. The area is called infarct. There is necrosis, and this necrosis is due to arterial occlusion or impairment of venous return. It is red infarct or it may be pale infarct. Red infarct is due to arterial occlusion, and pale infarct is due to impaired venous return. And I have told you, sudden arterial occlusion is associated with infarction, and dilatation of arteriole is associated with hyperemia, and narrowing of arteriole is associated with atrophy of the tissue. I have told you there are so many factors that influences infarction. I have told you oxygen content of blood, diminished oxygen content enhances infarction, rate of development of arterial occlusion, increased rate of development of arterial occlusion is also an enhancement of infarction. I have told you dual blood supply is associated with dealing of infarction. Tissue vulnerability, the tissue which one is very vulnerable to hypoxia, like brain is more sensitive to hypoxia. So, in the brain there is, if there is ischemia, it undergoes infarction immediately. So, this is all about the infarct and infarction. Dear audience, now I want to answer of different questions. Onish Niki Ashish Rahman Polok. Address: what is the difference between infarction and necrosis? Thank you for questioning me. You know, necrosis is the sum of morphologic changes following cell death in living tissue is called necrosis. Suppose this is liver. This is living liver. It is composed of, hepatic globule, and each hepatic globule contains the hepatocytes. If anybody suffers from viral hepatitis, some of the hepatocytes undergo necrosis. Some of the hepatocytes undergo necrosis. So, necrosis is sum of morphologic changes, following cell death in living tissue is called necrosis. Again, the tissue is living. Within the living tissue, some cell undergo death. So, some death cells within the living tissue. After the death of the cells, within the death cells, there are some changes, and all the changes of this death cell is called necrosis. So, in necrosis, the tissue is living. Within the living tissue, some cells is dead. After death of the cells, within the dead cells, certain changes occurs. The changes in the nucleus and changes in the cytoplasm. All the changes, all the summation of these changes is called necrosis. And infarct or infarction. Infarct is nothing but necrosis. The necrosis is caused by ischemia, is called infarct. So, all infarct is necrosis, but all necrosis is not infarct. The necrosis caused by ischemia, that necrosis is called infarct or infarction. Another question, ovarian twisting A, arterial supply is impaired hote pare na. Very good. Shikha. Very good. Suppose this is the ovary and this is the fimbriated end of the fallopian tube. If there is twisting, definitely there is twisting of artery and twisting of venule. My dear Shikha, you can recapitulate the anatomy of artery and vein. You know the wall of vein is thin, but wall of artery is thick. Due to thinning of venous wall during twisting, the venous impairment occurs first, and there may be no twisting of the arteriole because the arteriole wall is very thick. Thank you. Why there is edema in red infarction? Afroja Parveen Akhi. You wanted to know from me why edema in red infarct, and also there is no edema in pale infarct. If there is arteriole sudden occlusion in the tissue and there will be no entry of blood here and the tissue becomes almost dry, all the venous blood is coming out here and this tissue is very much dry. As there is dryness, there is no blood within the capillary, there is no chance of edema in case of pale infarct. And we can recapitulate what is edema. Edema is called excess accumulation of fluid in interstitial space or in serous cavity is called edema. And there are so many causes of edema. One of the important cause of edema is increased vascular permeability. Another cause is increased hydrostatic pressure in blood. So, one of the important cause of edema is increased hydrostatic pressure in blood. Suppose this is the capillary lining endothelium like this. If hydrostatic pressure is increased here, there will be coming out of water in the tissue, and this coming out of water from the capillary due to increased hydrostatic pressure in capillary, there is edema. In red infarct, again in red infarct, artery is okay. There is impairment of venous return. So the capillary contains blood here. The blood is not coming here due to impairment of venous return. As due to impairment of venous return, blood is not coming from the capillaries, so there is stasis of blood in the capillary. In the capillary, stasis of blood. Due to stasis of blood in the capillary, following impairment of venous return, there is increased hydrostatic pressure, so there is coming out of water and edema. Again, in red infarct, there is impairment of venous return. Due to impairment of venous return, there is accumulation of blood within the capillary. Due to accumulation of blood within the capillary, there is increased hydrostatic pressure. Due to increased hydrostatic pressure, fluid comes out of the capillary and leads to edema. Fourth question, pale infarct occurs in heart, but why not red infarct? Thus, heart is supplied by both arteries. Dear student or audience, you know we have some end arteries in our body, and there are many co-circulations in our body, in many tissues. In heart, what happens? Suppose this is the coronary artery and the branch of coronary artery, like this branch, and if this is the branch occluded and it supplies this area, if occlusion of this branch, this area is devoid of arterial blood supply and it undergo ischemic necrosis. It undergoes ischemic necrosis. So, there is pale infarct. Some dash questions me. Any questions? Dear audience, today up to this, thanks all. Before ending my session, I want to announce, if I get opportunity or time, again I will appear in front of you. Before that, I want to announce, I have YouTube channel and Facebook page. You can visit my YouTube channel and Facebook page to know more and more lectures regarding the general pathology and hematology. Thanks all. Question aro hoy nai keno, question kom.